As MyCare Ohio Ombudsman, function as advocates for people regarding their concerns and their complaints on MyCare Ohio issues. So what that means is that can be anything related to MyCare Ohio. It can be a person might have problems with services in the nursing home, in an assisted living, or it might be their home and community-based services. Their aide that comes to help them in their home might have problems with that or getting that service, or it might even be somebody who's in a hospital. So any of those settings and any of those services actually that a person receives under MyCare Ohio, the person can call the Office of the Long-Term Care Ombudsman at the state and report that they're having a problem, and we'll try to help them with it.
Members are guaranteed the right to be able to contact their ombudsman without retaliation, and they do have the right to voice any type of grievance. A MyCare Ohio ombudsman might help somebody who's living in a nursing home by helping them understand their benefits and maybe requesting items from the nursing home that will be paid for by the plan, such as maybe a wheelchair to be able to access, go outside the facility, to be able to remain part of their community, possibly like a motorized wheelchair, or also transportation needs, maybe to and from dialysis or another medical provider, making sure that that the nursing home knows how to bill as appropriate and that the plan is covering those services.
MyCare Ombudsman can help people with any home care issue they have with MyCare Ohio. Examples of that would be their aide not showing up, possibly them not being able to get enough hours of service through their care manager or their waiver service coordinator. If they have problems with transportation, the MyCare Ombudsman can address that type of issue also. A MyCare Ombudsman can help a consumer find out who their care manager is by contacting the plan directly, or by possibly contacting the Area Agency on Aging and getting the name of the care manager, providing the consumer with a number of the care manager, or if the consumer wants the MyCare Ombudsman to contact the care manager directly, we can do so and ask the care manager to please contact the consumer. And then we would follow up to make sure that that was done. The MyCare Ombudsman can help people with provider selection by contacting their waiver service coordinator or the plan directly. Each of the MyCare Ombudsman has a specific contact at the plans in their region who we can contact and say a consumer needs a particular provider, they're unable to find one, or maybe they have one, and we can ask the plan to do a one-time contract with that provider for the consumer.
MyCare Ohio Ombudsman can help with any appeal or grievance. So we can help with the first level appeal, or then after, which is with the plan, or then after that going to the state hearing. In terms of a grievance, we can make sure that the plan received the grievance, has filed it as a grievance, and then depending on their investigation, whether that has been reported to other entities essentially for accountability to make sure it's reported correctly.
So anybody can contact a MyCare Ohio Ombudsman and report an issue or a concern or a complaint. So that could be the consumer themselves, or it could also be a family member or a friend. It can be the actual provider of service can say that they're having an issue that they would like help with, or it can also be the insurance company that would call us and say that they're having issues. So anybody really can report an issue related to MyCare Ohio to try to help a consumer.
We want MyCare Ohio consumers to know, regardless of where they live, whether that be at a residence, a nursing home, or assisted living, that they can always contact the MyCare Ohio Ombudsman with any concerns that they have, whether that be a concern regarding a hospital, a provider, even a transportation provider, or a home health agency, and we will work with them to make sure that their needs are met and that they are getting the benefits that they're entitled to.